welcome to this episode of Health Talk. My name is Dr. Sihle Tango, and I'll be your host today as we continue the conversation on breastfeeding. Today we have a very special guest, Sister Anna from Centricity, which is a baby wellness clinic, and she's going to have the discussion with us on how to adequately breastfeed your baby. Welcome, Sister Anna, to this episode of Health Talk. Thank you so much for joining us today and being our guest.
Thank you so much for this opportunity, Sinclair. I really appreciate this opportunity.
So I want to hear about how you started in this industry, in this baby wellness and lactation industry. How did you come about it?
So I've been wanting to own my own practice for many, many years. And the opportunity only really came about 4 years ago to do the whole baby practice, private practice. My lactation journey started in 2010, where I met my mentor. She became my mentor, and she said that I have to write an exam to be able to practice as a lactation consultant. So, and that's what we do. You know, it's a very young profession, and yeah, I wanted something challenging. I got something beyond challenging.
And talking about challenges, what type of challenges do your patients come with? Why do people usually consult with you?
They usually consult because their nipples are sore, just basically. You know,
and they're like, make this stop.
and then they say, no, how do we fix sore nipples? You know, and then that's where they go on the Google and then they look for this area, you know, because there's lots of us around South Africa, well, globally, and then we've got different areas that we practice from, and then the prospective client chooses which area she would like, well, chooses the lactation consultant in that area and then contacts her.
So we're on this topic of nipples. What is the biggest cause of this nipple pain during breastfeeding?
Can I ask you, why do you think that is?
I think it's probably because we're not doing it right. Probably not positioning well or latching well. These are the things I've heard people say, obviously.
No, you're right. It is really that. Because the baby's not latching correctly. And so when the baby doesn't latch correctly, mom is in agony. So, you know, like agony, or she thinks I'm just so strong, I can handle this pain. And then it also contributes to poor milk production when there's a poor latch. Yeah.
When is the best time for somebody to consult with a lactation specialist? Is this during their pregnancy journey? Is it only after delivery? Is there a perfect time?
Totally. Pregnancy.
Yes.
You know, please contact during pregnancy. So the whole thing is, people have got this strange idea about how breastfeeding must just happen. You wing it. Like with everything to do with kids, you wing it. You don't wing it. There's information out there, and there's lots of research that has been brought forward. And it is, you know, like it's the infant formula was such a big thing, and then they realized babies were dying, and then the World Health Organization said, why are they dying? And it's because of not breastfeeding. So then they started discovering what was the issue. So then they discovered this: when a poor latch is there, poor milk supply. So you have to fix the latch to make a good milk supply, and understanding how breast milk works in the pregnancy makes it easier to do the transitioning and understanding where the baby is at, and also where the breasts are at, because they change, especially in the first week after birth.
Yeah. What makes breast milk so special compared to, for example, formula?
Well, you can't compare the two. I just need to point that out. Yes, it is milk for the baby, but it's like you can't compare an apple to a banana, even though they're the same. It's a fruit, but they're very different. So why is breast milk such a big thing? Is because it's alive. It's got antibodies. And it's something that the infant formula doesn't have. Breast milk caters for the baby's needs at that time, you know, and it changes, you know, even from feed to feed, it changes according to what the baby needs at that time. And that's how smart our bodies are.
I think that's absolutely amazing that your body changes depending on the needs of your child.
It's amazing.
And talking about breast milk changing and so forth, is there a change, or let's say, how often should you be breastfeeding a newborn, and how does that change as the child gets older?
So the frequency remains the same. So we're looking at, from the beginning, 8 to 12 feeds in 24 hours to be normal. what we perceive to be different as the baby gets older is that they start stretching the night sleeps. So they don't feed as often at night, but they make up those 8 feeds in the daytime. And because we're awake during the day and we're not so frazzled at night, we don't mind, or the mothers don't mind breastfeeding that often during the day because baby's sleeping better at night. But essentially the frequency remains the same. It's like us, I mean, how often do we put something in our mouths?
Yeah.
From the time we wake up.
Yes.
Say you wake up at 6 and by 10 o'clock, you've probably had water and tea or coffee and a snack and breakfast. You probably already had something to eat and drink at least 4 times. So it's a similar thing. It's just that it's heavy on the mom because she's the one who has to provide everything that the baby needs.
Yeah. And I think one of the aids that women are using these days is to use breast pump or express. How do we fit this expressing or breast pumping into one's lifestyle? Are you pumping as often as you should be feeding? How does it work to make sure that you keep getting the same supply or a good supply of milk?
So essentially we want the baby to learn how to latch to the breast as early as possible.
Okay.
So if we can do that from within the first week, where the mother feels absolutely no nipple sensation while the baby's on the breast, that happens, the mother does not need to express at all because the baby's doing the good job. Okay, so the hormones are working, that everything is in harmony between mom and baby and hormones and all of that. So usually mothers feel that they would rather express breast milk and not breastfeed in public, which is sad.
Yeah.
Because now what do people see? They see a bottle and they don't know what's in the bottle. They don't know that it's breast milk. So I mean, it's just sad that you see more bottle feeding without understanding, and then what does the public see? They see that as normal. They don't understand that there's breast milk in the bottle. So the expressing, I suppose it depends, is the mom going to go out for a period of time? Got a lot of moms who are studying, and they're going to go write an exam that's 2 hours long. So you take into consideration her travel time, and then she's guided to express after feeds, because then that is to build up the milk supply, because we can't compromise the baby's milk volume by expressing first, just because you're going to go in 2 days' time to write an exam.
Yes.
So it's a whole planning. Requires a lot of planning.
Yes. Yeah, you plan your life around feeds.
Pretty much.
Yeah.
I mean, it gets easier.
Yeah.
Because then you get so used to it, and then it becomes second nature.
Yeah.
Yeah.
Do you have a preference of mechanical pumps versus electronic pumps if you're going to choose to use a pump?
That depends on the mom.
Yeah.
I mean, I've had a few moms who have gone from an electric pump, and then she said, didn't work so well. Tried the manual pump, and she said, still, my breast still felt full, especially with the babies who are born early, prematurely, and they end up in ICU, and the mother's expressing for these babies.
Yes.
8 times in 24 hours. It's a long time.
Yes.
It's plenty of times, And I've had many mothers hand expressing.
Yes.
And they do a fantastic job. They do better than, and I've seen them. And the ladies that are having these electric jobbies going on, and they look at this mom and think, my gosh, is your hand doing that?
Is there a technique to it?
Totally.
And I'm sure that's something that you teach.
It's all technique.
Yes.
All technique.
Now, we've heard of this word colostrum, which is that first milk that you produce, if I'm not mistaken.
That's correct, yes.
And we've heard of that colostrum harvesting, which is something that they never taught us in med school. Can you give us a bit more understanding about what is colostrum harvesting?
So colostrum harvesting is also new, hey? It's not I suppose it has been done, but it's not something that has been promoted because mothers are wanting it more and more. We find this with the mothers who've gone for antenatal education on breastfeeding, that how can I make sure that if something happens, that the baby goes to neonatal ICU, I want my baby to have my milk. Now, if I had an emergency cesarean section, I might not be with it or whatever. So then the lactation consultant said, okay, let's harvest colostrum.
Okay.
So you express from 37 weeks in the pregnancy. Does it bring on labor? That's also, there's a controversy around that.
Because that's what we were taught in med school. You don't stimulate the breast because it can stimulate contractions.
Yeah, so it's because of the oxytocin. You know, the oxytocin brings on labor.
Yes.
We need oxytocin to make the milk flow.
Yes.
So now, but you know, so they say, you know, let's do 5 minutes expressing and see how much comes out. Keep it in a syringe, label the day and the time that you did it, and keep it in the freezer. And then when you come into hospital, bring it with you, just in case the baby needs it, to know, or if the baby's not latching for whatever reason straight after birth, at least there's the colostrum waiting for the baby, you know. And it's not something that you do often, you know. So you're not expressing every 3 hours like you would after the baby's born and the baby ends up in ICU, you know. So it's not something we do. You're not going to express 8 times, because I'm sure that would bring on labour.
Yes, I'm sure.
We haven't tried that. You know, so it's a couple of times a day that we do that, and then we just harvest it in the freezer.
Now, let's talk about storing milk.
Yes.
How long can you store it outside of the fridge in room temperature versus the fridge versus the freezer?
So you can do it. It is the 666. We were talking about it, you know. So it's 6 hours out of the fridge, 6 days in the fridge, and then you can freeze it up to 6 months.
I think that's amazing that you can do so much with breast milk.
Absolutely.
I've heard some myths about breast milk that I'd love to share with you. I've heard moms talking about putting breast milk in the baby's eyes. Have you ever heard of anything like that?
It's not a myth.
I'd love to hear more about it. Tell us.
So some babies are born with blocked tear ducts, so they have these cloggy eyes. So yes, I do. I encourage all my moms to express breast milk, clean the eye with the breast milk.
That is amazing.
Rashes on the face.
That is amazing.
Nose drops. Bum rashes.
Breast milk is so versatile.
Besides it being food, it is medicine. It really, really is.
If you had one piece of advice that you would give expecting moms or moms who've just had a baby related to breastfeeding, what would be that piece of advice that you would give them?
I would say looking after a baby, first, especially in the first 6 weeks, it's hard. It really is hard. It's not something easy. It's not something that you just adjust. Everybody adjusts to a new baby in your life. What I can say with breastfeeding is be patient, persevere, and persistence. And once the baby knows, and that's what mothers are teaching, so that's the lactation consultant's role, is to teach the mom, to teach the baby to latch onto the breast by itself. So all the mom does is just sit back, have the baby. She takes out the boob and the baby goes for it.
Yeah.
That is what we want. And the way we do that is by, this is the process that we're looking at. So yes, it is hectic the first few weeks. And once the baby knows how to latch, it is smooth sailing after that. Sincerely, it is. And it is a mindset. I just need to say that, you know, it is a mindset that mothers think, oh, if I don't get it right, then I'm just going to give up, you know, without even giving it a fair chance. That's why it is patience, persistence, persist and persevere. It really pays off in the long run, where mothers are sitting relaxed, babies on the breast, and good to go.
Everything is working as it should.
Exactly. But the first few weeks, it's not easy. I don't know how to sugarcoat that. It just is not easy.
So our previous guest, Dr. Alma Cele, shared her experience with her child having a tongue tie. How do tongue ties affect the breastfeeding process? So the tongue and the jaw is very active in taking the milk out of the breast. So the baby is the one who does the job. So the baby must be able to move the tongue past the bottom gum to be able to create this negative pressure to pull the milk out of the breast. Now, if there's a tongue tie, if nobody, it's a piece of skin that's stuck underneath the tongue. So the baby's tongue can't go past the bottom gum. So now if that happens, then the baby starts to crunch the mom. And then the mom feels the pain. And as I said earlier on, feeling nipple pain, less milk production, and you've got a mom who thinks, this is for the birds, I'm not doing this. And all we have to do is just check underneath the tongue to have it released. And what is the long-term implication of tongue ties is, the big one is speech impediment. They can't do the la la la, na na na, ra ra ra.
and he's speaking Zulu and Xhosa, need to know those clicks, and these babies find it very hard to do that. Well, not babies, they'll be toddlers, learning to speak, and they can't move their tongues properly.
Wow.
Because of their tongue tie. And there's a few other things. We discovered that babies develop lots of cramps. They can't sleep well because now, when you lie down, your tongue goes to your palate and their tongues don't, stays down. And that's where they swallow lots of air.
Wow, this is new to me as well.
Yeah,
wow.
So it's a big thing, that, and more research is coming forward with regards to what is the implication of a tongue tie. And it is something that needs to be looked at. Yeah. And I understand parents are scared. Oh, what you going to do? You're going to cut underneath my baby's tongue. You're like, what are you going to do there? But you take the baby to a specialist. So there are ENTs that do it. Even dentists do it, So it's always an important thing to have the baby examined by the lactation consultant or by a doctor and not all doctors, sadly, and I'm talking about pediatricians, agree with the whole tongue tie thing. They think, we're talking rubbish, and we see the results of it as the child grows older, So, that's where the challenges come in.
Yes,
How do you convince people that it's a good idea? But then they have to make their own decision.
Yeah, they have to. Yeah, they have to make that decision at the end of the day.
That's right.
So the 1st to the 7th of August is International Breastfeeding Week. What is the aim of such a week?
So the aim is to create breastfeeding awareness, that it is normal. And that's the big thing, is to make sure that people understand that it's normal. And then there's an organization that started many years ago, I can't remember exactly when. So they're WABA, it's the World Alliance for Breastfeeding Action. And they come up with a theme or a slogan every year that gets given to all the lactation consultants and to the medical fields that looking after babies and pregnant women. And the slogan for 2023 is Step Up for Breastfeeding, Educate and Support. So that is the whole thing, is that we need to support breastfeeding. It's not something that even though we have mom and baby that is holding her baby to get the whole breastfeeding thing right, if she doesn't have the support of her partner, her extended family, it makes it really, really hard. And that's a lot of one of the big reasons women stop breastfeeding is because they don't have that support. And that is where we need to step up as lactation consultants to educate and support these women in their journey. So that's a big thing for us, yeah.
And that's exactly what you're doing for us today, educating us on breastfeeding. So I think that ties in so well with the aim and the purpose of this organization. Definitely. I actually have one more question to ask.
Yes.
Is there a time you should stop breastfeeding? Is there such a thing as, okay, my baby is 2 years old, I now need to stop breastfeeding?
So my textbook says 7 years of age.
Oh, wow.
Yeah. Are you shocked?
I am.
can see you're totally shocked.
I'm shocked. I would never think that would be the recommendation. 7 years.
7 years of age. So the World Health Organization has said, so we'll do exclusive breastfeeding for 6 months, introduce solids from 6 months, carry on breastfeeding up to 2 years or more, depending if the mom wants to. So that's we're looking at the ideal being 2 years at least.
Yes. Yeah. That's amazing that you can breastfeed until 7 years.
Yeah. As long as the stimulation is done correctly, there's always milk.
The human body is absolutely incredible.
Totally. I agree.
Thank you so much, Sister Anna, for joining us on today's Health Talk and enlightening us more about breastfeeding and everything that you need to know about breastfeeding.
Thank you. Thank you for the opportunity.
Thank you to our viewers for joining us on today's episode of Health Talk. Thank you to Sister Anna from Centricity. We'll be sending you guys her details so that you can make an appointment. And to recap on those pearls of wisdom from Sister Anna, breastfeeding requires a community. It requires perseverance and patience. My name is Dr. Sihle, and this is Health Talk.